So you're in a position, you need a full arch, or a full mouth, I should say, implant reconstruction done. Your teeth haven't done real well, and you're probably interviewing a lot of different offices trying to make a choice about how to do this. The big questions are easy: finances, and how much does it cost here, and how much does it cost there. But two very important questions I think everybody should ask their doctor. One, I want to see pictures of cases that your doctor has completed. I want to have an expectation on am I going to get for a prosthetic when I'm done. The reason this is important is there's more than one way to do these cases. There are bone and gum tissue preserving techniques where only teeth are replaced. There are minimal bone removal cases where some gum tissue and teeth are replaced. And then there are maximum bone removal cases where a lot of gum tissue, a lot of bone is removed, and the prosthetic now starts to look more like a denture than actual teeth. So you want to know, and the reason being is some offices only do it one way. In other words, they won't give you a choice on doing it the bone preserving way or the bone removal way, and they won't go over the pros and cons of each. So ask to see what your prosthetic is going to look like. The second most important question I think that should be asked is, who owns the practice I'm in? Is it owned by the doctor performing the surgery, or is it owned by a corporation? The reason being is that a lot of these implant reconstruction outfits are chains. They're national chains. It's not hard to figure out who is and who isn't. I mean, if there's an implant reconstruction in 5 different cities with the same name, that's a chain. Now, the problem with chains is not the surgery itself. It's that you're making a decision. You're interviewing a doctor. You're credentialing a doctor, and you are trying to find someone who you think you can get along with, who you think is credentialed, who you trust to do this surgery. It's all good and well until your surgery happens, and 3 months down the road, you have some sort of a problem. Something breaks, which does happen, or an implant doesn't integrate, and you return back to your practice only to find out that great doctor you picked, who you really loved, is no longer your doctor. And so now you're stuck with whoever's there. And it's kind of an uncomfortable feeling. I personally think that people should choose a doctor who they can believe is going to be around for the long term, so that their case can be serviced and so that relationship exists between doctor and patient. It just works better that way. So there you go. 2 questions. Make sure you ask them.